Welcome, everyone. A little bit of slight technical difficulties getting started with our panel today, but we are excited to be here. This panel is on reimagining development. And again, it's great to be with you. For quick introductions, my name is Roger Ford, and I have the honor of serving as the 2020 SID Washington Annual Conference Committee Chair this year. I'm also Managing Director with Accenture Development Partnership, Accenture's international development practice, where we work with the international development community and the private sector to drive development impact and help progress the SDGs around the globe. Today's topic is a very important topic because we are truly living in unprecedented times. We are all continuing to grapple with the current COVID-19 induced realities. International development organizations covering all sectors of development have had to rapidly pivot programming, rearrange priorities, and adapt to drastically different operating environments and new business requirements. This panel today will discuss what this new normal looks like for international development organizations, the implementations they manage, and each of our speakers and their organizations will talk about what they're doing to address this change and be successful. SID Washington earlier this year explored this topic, but the feedback from all of you to discuss it further has been overwhelming because we are all in this together. And because we all share this together and face the same realities, we can learn from one another and share best practices, hopefully commiserate in each other's challenges and sometimes the setbacks that happen every day. But we'll look forward to opportunities to collaborate and move development progress forward. Perhaps in certain instances, even better and more impactful than ever. To drive our discussion today, I'm very honored and excited to be joined by 5 prominent colleagues from across the SID Washington community who will help bring this topic to life from their own perspectives, as well as the experiences from their collective organizations. Today's panel includes Nicole Barnes, the Vice President at Rti International, Julie Becker, Senior Vice President, Global Health at Chemonics International, Jeremy Cantor, Vice President of Development Innovations at DAI, Thomas Riley, President of Tetra Tech ARD, and Eric Uggen, Vice President, Economic Policy and Governance, Nathan Associates. I prepared a few questions in advance, but we will also be taking live questions from all of you as time permits. So please feel free to begin typing your questions into the chat window, and throughout today's session, we'll try to get to as many as we can live. So let's get started. So again, virtually every organization and company in the world has had to quickly adapt to this crisis to survive and thrive. International development, that has meant everything from recalling overseas assignments, virtualizing and digitizing programs, revamping business development processes, and engaging and relying on local partners more than ever. Large global implementers and NGOs have had to adapt and in many cases completely revamp their global business and delivery operations to this virtual environment. And of course, we're all working primarily from home and collaborating through this new technology. However, with all of this said, there are still many uncertainties that lie ahead. And most of us realize that these unknowns and strategies and processes are a work in progress. Every day we learn more. And I know that over the months and the year ahead and the decade ahead, we'll be learning more and doing more than ever before. My first question to all of you is, given this current environment and the levels of disruption we've seen over the past few months, can you share some key recommendations or lessons learned about successfully developing and delivering programming in this new reality? And let me start by turning it over to Nicole at RTI. Nicole?
Great, thanks, Roger. It sure has indeed been a very disruptive and adaptive time, and I'm sure we're all going to learn a lot from each other here. For a really brief background on Rti International, for folks who don't know us, we are a nonprofit independent research institute headquartered out of North Carolina, and we are dedicated to improving the human condition. We offer a wide range of services all across international development, but also in the social and laboratory sciences, as well as engineering. I'm going to speak to the part around international development, and in that case, we operate in a number of different sectors, including education, energy, environment, food security and agriculture, governance, health, learning solutions, water, and youth economic opportunities. So as you can see, we have quite a large footprint. In fact, we operate in about 80 countries. We're implementing around 100 projects. So to say that we had a lot of adapting to do is kind of the understatement of at least 2020, I guess you could say. So let me address the question that you asked, which was how did we adapt? A first way we did was that we realized we had to really think about risk in a totally different way. So what we did from an internal perspective here at the home office and across our US base was that we created an emergency planning team, which is our leadership team, which includes finance, all of the technical leaders and our executive vice president. And of course, we had to bring in contracts as well as other operational leaders because so much was happening in that first 2 weeks. And then of course, the first several months were just so disruptive because our first concerns were around the safety of our personnel and our beneficiaries. That's our number one concern. And we always make decisions with safety in mind. At the same time, local context matters. Like I said, you don't operate in 80 countries and 100 projects and expect a one-size-fits-all framework to work. So that makes it even more challenging, especially under a rapid decision-making timeframe. So we created and refined over time a risk assessment and approval process that helps us think through the many different factors that go into closing and reopening a project. And again, no two countries are the same. And just because you approve something opening doesn't mean it can't be changed, weeks later or days later, depending on what happens in a particular environment. Shifting from that point, we also did a lot of adapting, as you can imagine, in our field-based operations, which was significant. So there's a couple examples of what people did there. Like many people, we had to immediately go virtual in ways that we were not expecting. One example is from the USAID Reach Health project, where we had to quickly pivot from taking in-person data collection and using phone surveys to collect real-time and critical data on family planning activities. Also at the USAID All Children Read Cambodia project, the team initially started using Facebook to keep kids engaged in reading at early grades, but then they quickly adapted to do additional things through Facebook and adapting to engaging with parents both on Facebook and by phone, which is not something that was typically being done. Our teams also learned that they had to communicate and collaborate in even more ways, not that we didn't before, but even more with our local counterparts. A good example is from the USAID Acting to End Neglected Tropical Disease program in the East. When program activities shut down in Uganda and it was time to start restarting them, this is a program that requires a lot of defined logistical work in order to deliver the services on time. Really, that kind of collaboration with the government, the Ministry of Health, and our other stakeholders was really just unparalleled about how you shut down and reopen those critical activities. We also had to make sure our teams in the field were communicating in ways that they weren't always used to. So WhatsApp and Zoom became lifelines for a lot of our projects. And when that didn't work, people had to get creative, which is what you do when you're in the middle of something unprecedented. In the case of the Act to End Neglected Tropical Disease program in Ethiopia, there were some files that had to be shared physically. So what the team decided to do in Ethiopia was they would drop the files in someone's garden or front area of their home, ring the doorbell, step back, quite far, at least say hi to a colleague and then leave. So it was a way to both build the team cohesion and get the necessary work done. Another thing that we've had to adapt to at RTI is, being a research institute, of course, we implement programs for our clients around the world, but we also self-fund our own research because we really believe that contributing to the evidence base of what works and what doesn't in international development is key. And so every year we have a series of different research and development programs, and they had to pivot. So one kind of pivoted from working with data in Senegal, from the Feed the Future Senegal Natal and Bai program, to look at the impact of COVID on rural food supplies to inform farmer cooperatives about providing resources to households that need more support. This was done so that we could make sure we were having a pulse of what was happening locally so that we could inform clients, partners, and contribute to what's going on, not just try to keep emergency things going on as well. And of course, our colleagues in education are very concerned about the impact of learning loss and how that's going to be measured. We're fortunate to have a very robust set of programs that allows us to have data that we can do analysis in real time to help inform future program changes. And of course, it's really had a big impact for us for the fiscal 21 IRMDs that's our internal and research and development. For example, we'll be looking at resilience of water and energy utilities, especially in secondary cities, to see how we can best support there. And then last but not least, we really had the opportunity to use lessons that we'd already learned from other projects pre-pandemic. And a good example was all of our work in the education space using technology to collect data. And we've spent over a decade working on that. And so we were able to adapt a lot of that learning, add to it, and then adapt it across all of our programming. So instead of maybe something staying within a particular sector, even internally, it helped us really move broadly.
Fantastic. Well, that is a great overview, Nicole, and really, really appreciate it. I know the audience truly appreciates that as well. Let me turn to Julie at Chemonics, and let's hear similarly what you're facing over there.
Okay, well, first to introduce myself, I joined Chemonics earlier this year to lead our global health division, and my background is in public health program design and practice. I've been working in the global health field for many years, both in the NGO and private sectors. Chemonics, as many of you know, works multi-sectorally across not only in health, but democracy and governance, agriculture and education, and in health, we manage a number of projects, including our Human Resources for Health 2030 flagship, as well as PSM, which is USAID's flagship health supply chain project. Instead of talking about how we adapted as an organization, I wanted to share a couple of examples of how we've had to innovate and adapt our programs in the COVID context. So one example I'd like to share with you is from our SHARP HIV project, PEPFAR project in northern Nigeria, focusing on HIV testing and treatment. And when the outbreak began, we realized that we were really facing significant challenges, not only because our clients with HIV were hesitant to come into healthcare facilities because of fear of contagion with COVID, but also some of the facilities where we worked were actually being turned into COVID wards. And all of this was jeopardizing continuity of HIV treatment, which, as you may know, is incredibly important because if treatment ceases, viral loads increase, infectiousness increases, in addition to the risks to the patient themselves. So like many other HIV programs, we had to quickly pivot and start bringing services out of the facility to the community. And there were three main things we changed. First, we established community pickup sites where HIV patients could come get their medication refills, and we changed medication resupply from a 1-month period to a 3 to 6 month period. We also increased our support for expert clients, which are peer educators living with HIV and we gave them extra mobile phone support to work closely with their own HIV positive clients who could no longer go receive their psychosocial support at healthcare facilities. So in addition to that kind of support, they also directed these patients to canopies we set up in the communities where people could get their medications and also have their viral loads tested. And then finally, we established HIV testing sites in the community and brought services to high traffic areas as well as hotspots that we were able to identify through GIS mapping of HIV cases. So I think that what we learned is that we can do a lot more than we thought by providing healthcare services outside of the facility, bringing services closer to people in their communities. It's feasible and possibly as effective, if not more effective than traditional health services. And then quickly, a second example I wanted to give is related to the mental health of healthcare workers. And, healthcare workers already suffer from overwork and burnout. And under COVID, they were really facing serious challenges in terms of anxiety and stress, not knowing where to turn for help. So one solution we supported is we recently awarded a resilience prize to a Brazilian social impact company called TNH Health. And they developed an app called ViTalk. And this is a chatbot that's basically designed to improve mental health and resilience for healthcare workers. It provides them with psychoeducation, it monitors their mood, it provides sort of brief virtual counseling interventions, and it also identifies risks where professional support might be needed. So far, the experience has been limited to Brazil, but with the growing recognition of the mental health burden on healthcare workers under COVID, we're hoping to adapt this to other settings.
Great.
I'll leave it there.
Well, thanks, Julie. I mean, it's amazing to see the accelerated innovation and technology. That is obviously a key theme here, and COVID is actually allowing us to really accelerate in many, many instances, both programmatically and operationally, a lot of this technology, which I think probably would have been years perhaps to really reach the peaks that we're seeing now. So with that, Jeremy, I know there's a lot going on over at DAI. Can you kind of build on this?
Thanks. I'm Jeremy Cantor. I'm the Vice President of Development Innovations at DAI. I lead DAI's technical sectors and new business teams serving our US government business unit. And I've been with DAI for almost 19 years. And DAI is a leading USAID implementer in areas of digital acceleration, economic growth, environment, fragile states, global health, and governance. And 2020 marks the 50th year we've been working with USAID in partnership with USAID. And in addition to our extensive and longstanding work with USAID, DAI is the only firm in the world that's one of the top 3 implementers with USAID, DFID, and the European Commission. So I offer some perspectives working across donors. As Nicole and Julie both noted, early March was just an incredible, unbelievable time when we had to move, quickly, but conditions were changing almost by the hour. So you always had to double check whether you were actually moving in the right direction or had to continually adapt. I want to share some of the key lessons we've learned and sometimes learn the hard way on our projects as they continue to implement and pursue their development objectives. So the first lesson is really staying the course. Our projects absolutely maximize flexibility and ensure we're partnering with USAID to respond to the COVID crisis however possible. Procuring PPE, helping with technology with partner institutions. But at the same time, we've continued to focus on the core development objectives that our projects are built around, recognizing that these core development challenges that the projects are intended to address continue to persist, though COVID has often deepened or magnified those challenges. So, for example, we have a number of programs working with local governments and municipal governments, where the core challenges of planning and managing basic service delivery, communicating effectively with citizens, and raising revenues are really the principal focus. Well, those core challenges persist. The COVID crisis has really just added a new layer of complexity to that. But continuing to focus the project on that longer term development objective without getting completely sidelined by the immediacy of the COVID crisis has been something we've been really working with our project teams around. The second big lesson is just and kind of picking up on something that Nicole shared, is that the importance of responsiveness to our staff and counterparts, right? We've had to shift the physical locations of our colleagues and completely shift the modality of working. Most, if not all, of our staff are working from home with all sorts of challenges, from connectivity to family health, to everything else is happening in the household. I'm wearing these headsets because I've got 2 young kids in virtual school right now, and when they go on break, they're all over the place. And that's the case with our project staff, our home office staff, our beneficiaries, and our clients. And we've had to really wrap up training and support of our staff, and recognize the need to be just much more attuned to the needs of our staff and our counterparts and our clients. Not just like professionally on how to use Teams or WebEx, but also just the stresses and challenges that surround them on a day-to-day basis. Our project staff and our counterparts and our clients are not working in the same way they had been in February, and so we really have to expect that our projects themselves are not working in the same way. Mm-hmm. And the final issue is really one of inclusion and access. We've had to shift to this virtual mode of operation, which has profoundly changed the issues of access and inclusion on projects, and in some ways really positively, but in other ways not as clear, and we just had to be very attentive to that. Sort of issues of bandwidth, but also language. So we have a program working in the Western Highlands of Guatemala. And so we're able to, get smartphones and get data to those the counterparts there. But the whole language on the phone is Spanish, and these communities that we're working in don't speak Spanish. So even just accessing the instructions on the phone present an obstacle to access and inclusion. And the same is, for counterparts in institutions, where if there is an outbreak of COVID-19 in a partner institution, those institutions are working profoundly differently than they had been before, and access of our beneficiaries to the services provided by that institution change dramatically. And just helping our projects think through the impact on inclusion and access has been kind of that third big lesson I want to share.
Great. Well, that was really rich, Jeremy, and some of those topics I know are very important to people. We can't lose the humanity of our organizations, our employees. Like you said, the inclusion and access, these are amazing and important themes that are really, really coming to the forefront within the COVID-19 induced environment. So, I thank you for touching on some of those. We are getting a couple questions from the audience that kind of touch in some of those areas. So we'll talk about those in a moment. But what I'd like to do next is move over to Thomas at Tetra Tech. And really, you guys are doing amazing work and would love to hear how things are going.
Thank you very much, Roger. And Jeremy, I could only laugh when I heard about the education of your children in the house. When I was preparing for this, I told my son, who's a little bit older, I think, you're in the basement and I'm going to put as much space between you and I today as possible. And I'm on the third floor using a little utilized office right up until COVID. I am Tom Riley. I'm the president of Tetra Tech ARD. Most of my career, I think 22 years or so, was spent abroad. Beginning my career with Catholic Relief Services in Africa for 3 years, and then switching over to Latin America, where I spent another 19 years. Most of that in the Andean region between Peru and Bolivia. I spent 17 years there. So I hope that I'm bringing a little bit of that perspective back as well to this discussion. And I always have that first and foremost on my own mind about how we're going to make those operational changes that need to be made. And as Nicole and Julie and Jeremy were speaking, I was cribbing and taking notes about things that we had not thought of. So thank you very much for that. We took, or at least I took a little bit of a different approach to this because I was conscious of the fact that we need to get ahead of the curve as well. And that's been very difficult because what we're dealing with here is a paradigm change first and foremost. And I think that's essential for our staff to understand in order to get ahead of the changes that are occurring. Because on a day-to-day basis, those changes can feel incremental. We're making adjustments and we're just a little bit further along. But taken together over a period of time, and what we see is that they're quite profound in the way that we operate. And we're doing things now that I think each of the speakers have pulled out that we had never considered we would be doing at this stage. Our tendency is to hold on to that old paradigm until we can't anymore. But I think we've arrived at that point with COVID-19. Now, we all know that there are changes that have been forthcoming in international development since even before the Cold War ended. What has changed, I think, is that the risk assessment has changed, that now change is less risky than complacency. And that has been very challenging for us to communicate both as managers and to comprehend, but also our staff working internationally, working in the home office to make sure they understand that as well. And Jeremy, I think in his talking about that, highlighted some of those changes and how difficult they are. But we also saw that in Development Disrupted and some of the other publications that have come out in recent years that have been struggling with these drivers, which have only been accelerated by COVID-19. So what have we been doing? We've been doing a lot of talking and a lot of listening, both internally with our operations abroad, with our home office staff, with our clients, particularly USAID. We've been having a lot of discussions about reimagining development and what do we need to do in order to get ahead of this curve. And it's very much in line with what SID is doing today, which I appreciate very much. And SID's leadership on these issues have absolutely been critical. And it's great to have this type of forum to have these discussions. It's like USAID has been engaged in this in the Over the Horizon Strategic Review as well, wrestling with the same ones. So we're questioning assumptions and listening as well as questioning, because I think there's a danger here that we'll hear in the presentations over the course of the SID event, and that is confirmation bias. It's really interesting that there'll be arguments that are made using the same data for one thing or its exact opposite as well. And it's in these types of forums where we can put those to the test and have discussions about what's working and what isn't working. So in terms of best practices to get to this and to sum up, technology, yes, it's critical and we're all using technology, some more innovatively than others. We're also relying on local partners and subcontractors. We're using local intelligence to do that. Recruitment and retention has changed. But I do want to highlight something I think that Julie mentioned as well, the need for mental health. Because in this paradigm shift, we have to get ahead of the curve. And that's a struggle for everything, for all the pressures that Jeremy mentioned as well, that the operating context has changed profoundly. We need to get ahead of that. So things like adaptive management, strengthening resiliency, mental health, and the ability to tolerate and manage change are all things that we've been working on to drive the process forward. Thank you very much, Roger.
Thank you, Tom. And last but not least, would love to turn to Eric now at Nathan Associates to hear what is happening in your organization. Eric.
Thank you, Roger, and thank you all for wonderful insights from around the group. I'm Eric Hugan. I'm Nathan's Vice President for Economic Policy and Governance. I've been working in international development, a variety of areas for the past 20 years. At Nathan, I'm responsible for the oversight and development of our USAID, MCC, World Bank, and DFED funded programs and teams working in economic policy, public financial management, domestic resource mobilization, and economic research and analysis. For those of you that don't know, Nathan is an international development consulting firm focusing on economic growth, economic development, economic policy, private sector development, infrastructure, finance, trade, and transport logistics. So as I was listening and taking notes, I was struck by a couple of the comments, and I'd like to add a couple points. And one of the things that we've been very much focused on and thinking about through the delivery of our programs is counterpart engagement. I, as a practitioner, as an implementing partner, steeped in the quality and the delivery of our work, technology has been a wonderful tool to maintain the dialogue, to maintain the communication, and keep things moving in an environment that otherwise, I think for a lot of folks, we thought that this was going to be really challenging. But as I think we've learned as we progressed through this, I think technology has also raised some issues and some concerns, and it's caused us to really think about, what the nature of delivery of technical assistance actually means. And I go back to this counterpart engagement because so much of our engagement is around communication, around the analysis of complex issues and working with our counterparts to work through with them solutions to difficult problems and helping them to see, alternative paths that might help them with both their day-to-day and their strategic management of issues. As you're limited in the communication flow, either with Teams or with Zoom, you miss maybe 15, 20% of the communication. And so this is where we're trying to break through. How else can we communicate? Are there things that we can do to bridge the gap that we may otherwise miss the opportunities? We can't walk the halls in this environment. We can't walk the halls of the Ugandan Revenue Authority and hear comments and things that we may not have thought of, or we may not have picked up on, that might help us with a particular issue or engagement. And so, we're looking to see how else we can, bring teams forward, maybe talk to the folks that we may not have interacted with in the normal course of business or through our normal counterpart reactions and discussions. And so this is something that we're working through. One of those things is to try to convene different tools for that and open it up to discussion for Zoom and Team and in ways that we hadn't thought of before. But we're still working on it. And I think, forums like these to talk about it, to put it on the table, I think is very useful.
Great. Thanks, Eric. And yeah, I mean, I know as I'm listening to each of you, I'm hearing many things that resonate precisely with my day and with my life, right? We talk about walking virtual halls. We talk about, how we're going to collaborate in an environment where we can't see everybody every day, be sitting together, whiteboarding like we usually do. We've moved a lot of that virtually, of course. But I know that each of you is kind of going probably through very similar experiences. The thing I found interesting is that it's often easier to get on the agenda of very senior people during COVID because they aren't traveling and they can make the extra time, before breakfast or after dinner or even on the weekend. So I do think there are some benefits, to this virtual environment. But as we all know, the mental stress of it all, the exhausting days that start early and late pretty much never end, in the virtual environment, are some of the new ways that we have to really adapt and learn to work without at the same time burning out. So I'm going to kind of move a little quicker now. We do have some audience questions, of course. I want to throw one more just quick one out to you guys, and maybe it's like a minute response, but we can't lose sight that COVID-19 has already resulted in over 1 million deaths worldwide. The Institute for Health Metrics and Evaluation, which is part of the Gates Foundation, estimates that extreme poverty has already gone up by 7% in just a few short months. And this is unfortunately breaking the 20-year streak of success we've had in development, in growing economic strength in these markets, of pulling people out of poverty. This is really setting us back. So given these economic and social challenges, I mean, in just a few words, what is your greatest fear regarding the long-term implications of COVID-19 in progressing and achieving the SDGs during this critical decade? So let me start again with Nicole. I mean, Nicole, what's your quick reflection on the impact this is going to have?
Well, let's think of the statistic that you just shared. I mean, what is that number going to be in 6 months from now, a year from now, 2 years from now? And that really gives us great pause. It's impossible to know, it's impossible to predict, and that gives us a real concern. There's also going to be sectoral impacts. I mentioned earlier, like learning loss in kids who aren't in school. I'm going to pick up on what Julie said in a different sector with malaria. If you can't keep your seasonal malaria chemo prevention on track, lives are going to be lost, similar to the example she gave in HIV/AIDS. So, there can be tremendous downstream effects and also economic impacts for countries that depend on remittances, like in Somalia where we're working. It's huge. And I just want to add in final comment to Jeremy's concern over, we don't want to make everything about the emergency response. I mean, that's obviously critical. I'm not trying to dismiss it, but true governance and service delivery requires long-term work. And if we pivot everything just to the immediate, so many things are going to be lost and get way worse. And that has tremendous impact, I think, in every sector.
Yeah, absolutely. Thanks, Nicole. And Julie, I know you've talked a lot about this topic. Maybe over to you for some reflections.
Sure. So, obviously, when it comes to SDG Three, health indicators are threatened in so many ways. And we've already begun to see some leveling off and backsliding in progress. And the toll of disruption in other health areas could in fact end up being bigger than the direct toll of COVID itself. So whether it's health worker shortages, because health workers are not only being diverted to work on COVID care, but they're also having their lives placed at risk, to SDG indicators like child death rates, the under 5 death rates. We're starting to see serious backsliding. Even though children don't become severely ill from coronavirus, their vulnerabilities are increasing because routine immunization is being interrupted, pneumonia care, diarrheal care, malnutrition is increasing their vulnerability, a whole range of factors there. In fact, I just wanted to give one statistic from the recent Gates Foundation Goalkeepers report, where they said that routine vaccine coverage has slid back to levels last seen in the 1990s. 25 years of progress erased in 25 weeks. Other indicators of maternal and newborn mortality, we've spent years trying to get women to shift from delivering their babies at home to delivering in healthcare facilities. And now people are afraid. They're starting to deliver at home where they can't get access to emergency care. And reproductive health, finally, those services have been disrupted. We're seeing increases in adolescent pregnancy, HIV, and STDs. So the impact on health, as I said, is already tremendous and is going to take us a long time to pull out from.
Yeah, thank you. Those are really startling and in many cases make us really, reevaluate and think about where this is going to end up and how we're going to actually get beyond, this initial crisis into this next decade and really continue to make the progress that we were making in global health. So thank you for sharing those, startling statistics and comments. Jeremy, give us your reflections on this topic.
Sure. A number of our projects are working with countries on issues of macroeconomic reform. And so we've had to, adjust quite quickly to now supporting these countries to address the economic impact of the COVID crisis. The development plans, based on SDGs, need funding, and of course, COVID has really shattered all those plans for the resourcing, and we know that national budgets won't be able to handle the costs of stimulus measures for falling revenue and increased public debt. There will be a need to, create this balanced approach to spending on the social sectors, education, health, housing, yet also provide aid to revenue-producing sectors, tourism, exports, to avoid kind of really draining the life out of these during the COVID crisis. And so then there's a gender implication, right, of the implications of the fiscal crisis, shortfalls on spending, as Julie has just noted and Nicole knows, in education and health, but also limited funds to spend on private sector resilience. I think the final kind of an even more complex dimension of this is the relationship between donors and our country partners in countries where governments are not stepping up or don't have limited capacity to do this planning and address the COVID crisis, which is potentially kind of profoundly changing that development partner, country partner relationship.
Absolutely. So, some very important points there, and maybe Tom, can you build on a few of those from a Tetra Tech perspective?
Unfortunately, I can, Roger, because this was the question that I was least looking forward to, because I don't want people coming to this event and leaving more depressed than they were when they came in. But I think each of the previous speakers had it exactly right. What we're talking about is a backsliding in terms of poverty, in terms of inequality, in terms of domestic violence, in terms of education and immunization, and all of that falling on the most vulnerable of young women and girls in particular. It's hard to paint a positive picture, of course, and we don't. We're going to need to confront that. Just to put it a little bit on a positive note, though, COVID does give us the opportunity to reinvent ourselves, to innovate, to renew, and give us a new impetus within the international development sector based on results. And I think that's important to say. I would also say one thing, an intangible that we have on our side. People get into international development because they want to make a difference. They want to feel inspired. They want to have impact on others' lives. And that gives us a tremendous amount of resiliency and drive to make sure that we're addressing these issues head on. So just to try and put it in a little bit of a positive perspective to say, if anyone's going to help resolve these problems, it's going to be us. Thank you.
Absolutely. And I do think there was a question that came earlier from the audience, which I'll talk about in a moment, about staffing and talent. So let's think about that as we take that question in a moment. And finally, Eric, just your reflections on COVID and the impacts.
Yeah, I echo the comments, and I'll just say that a lot of what we're looking at and preparing for are not only the tremendous risks to job loss, I think the transformation of entire sectors of economies, but also opportunities that come with that. And I think it'll be both a burden, an obligation in some ways to help partner countries and economies to think through some of those strategies, knowing that there are significant risks to not getting these strategies right and helping to pull through the most vulnerable. I think the risks that we're talking about can be quite depressing. And at the same time, I think that should spur all of us to action, that we have an opportunity here to address these things.
Absolutely. So, thanks to all of you for answering that question. I think it really brings the realities of COVID-19 to the forefront and what we're all facing. And we can never lose sight of, the end beneficiary and how we're going to help the world get through this together. I'd like to turn now to a couple questions. We've gotten some good ones here. And the first question is really around the impact of the crisis on talent and hiring. There's a lot of people out there, so there's some fantastic talent. There's new folks entering the field, as you said, that bring the passion, and they want to help. They're being thrown right into this crisis as their first, engagement in international development. From each, and I won't be able to throw this out to all of you, of course, but does anyone want to take the question of how has your organization thought about adapting your hiring processes to the new normal? Like, what are you doing today? Is there any perspective or tip you would give a would-be job seeker, maybe someone new to the field? Does anyone want to take this one? Tom or Nicole?
I can take a first stab at it. I mean, it's actually the same advice I would give even in the before times. Keep networking. New York Times actually recently had a good article on how to network remotely. And I'm encouraging that. We've had lots of new hires since the pandemic started. In fact, I get to meet later today for the first time two that live here in North Carolina that I've never met face to face. We're going to meet socially distanced in a park. So I'm looking forward to seeing that. But it's hard. So you have to stay networked. I think it actually really opens up for us having a broader employee base. RTI already had, I'm guessing, around 10% of our employees were teleworkers before. I can only imagine that's going to increase. I think it's really proven that people can work from anywhere, which is wonderful. So I'm actually pretty positive about it. And by anywhere, I mean both in the US and around the world. I think it really opens up the talent pool. And I think all of our organizations need change so rapidly that, I would really stay on top of what organizations are advertising for. There's a lot of opportunity here.
Absolutely. Thanks. Does anybody else have a perspective on that? If not, let me throw out another question that's come from the audience. What has been the experience of your companies in managing your contracts and development interventions online? What have you found to be the most pressing challenges in the way of handling your business in the new normal from a contracts and kind of a development interventions perspective? Does anyone want to take that one? Tom?
I would take that, Roger. We relied quite a bit, like all international development organizations, on face-to-face events and meetings and engagement, and that was very important to be able to take the measure of the client and the beneficiaries. And that's true in everything, whether it's technical assistance, monitoring and evaluation, compliance, contracts, grants, and procurement. There was a lot of direct engagement that powered that. And we've had to adapt to that, to a more remote working environment. And there are things we have lost, there's no doubt about it, but there are things we have gained in terms of efficiencies as well. That's worked quite well. And it has us reflecting upon our systems and whether our systems as they exist right now are going to be appropriate for the world we're living in now and are going to continue to live in, even if it's post-COVID. So that is, as you can imagine, quite a bit of implications for the organization on a whole host of fronts. It's not limited to any one particular area, but across everything that we do. And it goes back to that issue of a paradigm change.
Absolutely. Yeah, thanks for reflecting on that, Tom.
Matt, can I offer a similar perspective? But I think back, we had a proposal we submitted a couple of years ago, and we thought as an innovation we'd include an e-learning dimension to this program. And the feedback we got in competitive ranges, that will never work in this particular country, right? And now everything is e-learning, and it has to work in that particular country. And so just the acknowledgement of this is perhaps an imperfect way of doing the work, but the work needs to be done. And so even going remotely is adaptation, but there's adaptation within what that means. The size of engagements, the duration of engagements, the ways that you assess whether the information is sticking, has just completely changed. And I think we're always learning about how to do it better. So it's really then for us to harness that learning and then share amongst projects, which I think is the grand challenge of this, but also one where this is if we're going to make a difference and achieve these development objectives, that's what we need to be doing.
Absolutely. And you actually, Jeremy, you actually answered a little bit of a question that had come up. So I'm just going to say that, one of the folks in the audience asked is, everything is going virtual. We need to be able to address and successfully deliver in every market around the world. There will be many challenges ahead where, there is no electricity, there is no ability, maybe not even light, right, effectively to get to the last mile in every single instance. But I think this COVID crisis will accelerate the need, the ability, the innovation required to bring programming, to bring impact in a much more broad spectrum way than ever before. So I know we're going to innovate. We're going to be thinking about these markets in a greater way than ever, because they're the only way we can get there is through the use of technology. And I see we're almost, we're pretty much at the end of our time right now. As far as I know, we have about 5 more minutes. I'd like to, just kind of wrap up by saying, first of all, the ability for the SID community to innovate, to embrace this type of collaboration that we're talking about through this panel and many others is absolutely vital for us to, make a difference in the world. The thing I've learned most importantly about the SDGs is we have to be able to present the impact that we're having through the lenses and frameworks of the SDGs. It's a common language, right? It's a common way of communicating. And you'll hear about a panel, you'll hear in our closing plenary today about how we think development implementers and NGOs can work more closely to actually put our impact through the lens of the SDGs and report that back. I think this is going to be more important than ever if we're going to create a common dialogue that goes across the sectors, not only across the development sector, but if we can do this with government, if we can do this with the private sector, we're going to have a common way of collaborating and working together better than ever before. I think, to leave this on a, silver lining, I think that, we've been talking about accelerating development, amplifying impact, infusing innovation, doing human-centered design to make programs more empathetic towards the communities they need to serve. All of these themes are coming directly into the forefront of what is needed to work in a COVID-19 new normal. And I truly think that this is bringing a direct, visible lens, a direct, visible platform to our donors and to governments around the world. And I truly feel that coming out of this, we will be stronger than had we just been running development over the next decade the way we've always done it. There's going to be innovation. There's going to be technologies that come out of this that we never would have thought of or never had the funding to accelerate in the way they're being accelerated. Of course, there will be many, many setbacks. It keeps me up at night thinking about what tomorrow will bring, whether a program's funding will be cut or redirected, whether technology will be there to deliver a program that we want to do and have it work effectively. So I know there's a lot of unanswered questions, but I think we're on the right track as a community. I hope that you'll have an opportunity, all of you listening today, to listen to the panel that Wade Warren is running, a very similar one, pretty much a mirror image of the one we just conducted here. You've got to hear more institutional members and others talk about how they're adapting. And then we can all get together in future sessions during the remainder of this year through the SID community to really put a lot of these perspectives and crystallize these best practices even stronger than we're doing here today. So with that, I wanted to thank each of my panelists and colleagues here for their great insights, their best practices, their wisdom, and look forward to working with you all over the months and years ahead. Thank you all again.